This is Professor Michael Chapman. I'm one of the most experienced IVF doctors in Australia. I believe that an important part that I can contribute is to educate patients in relation to fertility, infertility, and all that involves. These series of podcasts help to educate you. I hope they are helpful to you. If you wish to know more, however, I'm more than happy to have you contact me via email, which is profmchapman@gmail.com, or make an appointment to see me on 9138 4222.
Okay, Prof, could you talk about options available for men with infertility issues who wish to have biological children through IVF?
Sorry, can I just clarify the question? What things can be done to improve sperm quality in couples where they're trying to have a baby? Is that what you're asking me?
Yeah, and like actually, sort of a related question is same-sex couples. Like, what are their options?
That's a separate issue altogether. Yeah. Because I mean, it's not a separate issue because the same-sex couple are going to have to, or if they're male, are going to have to find a surrogate, create embryos to put back, and therefore their sperm quality is going to be important. So we might talk a little bit about the same-sex couple, males, looking to undertake surrogacy. First of all, I'd say that it's legal in Australia. There's no problems undertaking surrogacy with a male couple. There are many examples of it. The process, however, is complicated and expensive. Whether you manage to get it in Australia or you travel overseas. And the majority of surrogacy cases in this sort of situation are generally done overseas, from my experience. If a male couple in Australia decided that, or found that there was a surrogate prepared to carry their baby for them, the first steps in that would be to approach an infertility clinic and get the basic investigation is done to ensure that a pregnancy is a possible and sensible thing, which starts with, obviously, a semen analysis. Once that's all good, then the next step is to do all the other testing to ensure that they're negative from a laboratory perspective, negative for Hep B, Hep C, and HIV. Being positive doesn't stop things happening. It just means the laboratory has to be a bit more careful in terms of handling your sperm in that scenario. For the male couple, they've also not only going to find a surrogate, they've also got to find a donor, someone who's prepared to donate eggs, and that person will need to go through the similar screening tests to make sure that they're okay to have IVF, and be aware that exactly what's happening. So that, for instance, in New South Wales, and now almost in every other state, if you donate eggs and you get a pregnancy, your name is going to be on a register held by the Department of Health that the child could access in the future. What normally happens in relation to the donor is that they will be seen by a doctor, by a specialist. They will then have 2 or more counselling sessions on their own and with the recipients, so that everybody's clear on what's going to happen in the future in relation to seeing the child or not seeing the child, and revealing who it is that's the donor of the egg. So there's that bit next. So that's sorting out the donor and them going through an IVF cycle. And that obviously is in the domain of the fertility specialist. The next phase is the sorting through the surrogate. So the surrogate obviously needs to be medically appropriate to be carrying a child, that they are doing it in Australia altruistically, albeit guideline is that reasonable expenses are acceptable. And although there has been one suggested level of reimbursement in a court in Queensland some years ago now, that $25,000 was probably appropriate given time off work, time for the to be in hospital, the visits to the hospital, ultimately the birth itself, and the recovery from the birth itself. So 25,000 is acceptable in Australia. I think no court would say this was not an altruistic effort, even though $25,000 changed hands. What has to happen is that the surrogate needs to get specific separate legal advice, and the IVF clinic will need to know that they have that advice, be seeing that advice. They too will go through counselling within the IVF clinic so that they're aware of what they're doing and what the potential implications are. The recipients of the baby, the commissioning parents, as I think one term for them, the commissioning parents also have to go get their legal advice, which will involve a contract between them and the surrogate in relation to handing over the child. And once all that is in place, the process begins. The actual physical process begins, which is to start with the donor going through a cycle and creating the embryos, one of which would be put back in the surrogate each cycle and hopefully achieve a pregnancy that way. So in Australia, a cycle like that is probably going to be out of pocket something in the order of $10,000 to $15,000. The cost of the surrogate around $25,000 for altruistic donation, and then the medical costs associated with that surrogate. Because I'm sure that most commissioning parents would want them looked after by a private obstetrician in a private hospital to ensure the best outcome from that baby that they're going to get. Once the baby is born, something in New South Wales, and it varies from state to state, something called a parenting order is issued, which gives the child to the commissioning parents as their legal child. In some states, you have to go through an adoption process, which can take some years. The parenting process takes weeks or months, as I understand it. And then the child is there. So it's long and a complicated process for a male couple to achieve a pregnancy, but it is doable. And I've certainly seen wonderful outcomes from such arrangements. I said at the beginning that the majority of people go internationally because of the lack of women prepared to be a surrogate in Australia, because they don't get paid particularly much. So most people go internationally. US is probably one of the major places where it's not illegal, where money changing hands to the surrogate is accepted part of procedure. But couples coming back from the States tell me they're spending $100,000 to $200,000 getting to the point of having that child. Internationally, other options, Eastern Europe has been a regular place to go, significantly cheaper, but still in the 100,000 mark once everything is put together in terms of airfares and accommodation and the costs of the surrogate and the costs of the clinic. So nothing's going to be cheap. But good clinics exist in Georgia, in parts of Ukraine outside the war zone. So there are places around the world where you can find paid surrogates.
And don't forget that you can access all the previous episodes by going to our website www.theivfjourney.com and select IVF Journey podcast from the navigation menu.